It's Monday, January 4th, 2021, and I bring the meeting of the Board of Health to order, Douglas Board of Health, I should say, to order. First on the agenda, we're very fortunate to have, let me see, oh no, this is a health agent update, I'm sorry. Health agent update. So you're on, Agnieszka.
Health agent.
Yes.
I think health agent.
Oh, that's me.
Right?
Yeah, what am I thinking? Okay. All right. The situation is, I did an inspection on the Ledoux outdoor boiler again, and I met also with the neighbor Vivian, and this was last week. Basically, there's very little that we can do about, enforcing any kind of regulations on the outdoor boiler because it was installed back in 1996. So it's pretty much grandfathered under any regulations that have since come about. However, I did say to him, and I'm sure that, well, Corey, you've been involved in this situation here. But anyway, regardless, I couldn't take either one side, of course. But the way I put it is that I spoke with Vivian first. She told me the same kind of story. And I basically, what I told her is I said, if you want to pursue this matter, you'd have to take it to civil court level. And she said, oh yeah, but and on and on. Then I went over to Ledoux, Henry Ledoux, and spoke with him. He was a little bit angry, to say the least, but he did eventually calm down. And what I told him was that he has a boiler here that he's responsible for, regardless of whether it falls under regulations or not. He's still responsible for the proper operation of that boiler. And it still can't affect neighbors around him if he doesn't maintain the boiler properly. So he had exposed wiring. His smokestack was, it was high enough, but it was old stainless steel flue pipe. I don't know where he got it. I don't think he bought it new, but he claims he did. It's all dented. Inside is probably loaded with creosote. And on that particular day, it was smoking like crazy. So I told him, I said, look, everybody or anybody who has a boiler or a water heater or whatever they might have in their house, they have to maintain it. That's all part of owning that type of, device. And so I said, what I expect that flue to be changed. I want that flue changed. And I also want the wiring better secured and better protected. And I told him that I would be back in 2 weeks to re-inspect. He said he would go about doing that. I mentioned if you need any extra time to give us a call right away and we'll set something up. But that's basically what we have for the health agent update. Any questions?
Very good, Bob. Thank you.
Oh,
Okay.
look who's there.
Hey, Dick.
Hi, Dick. How are you?
Yep, Dick's just arrived.
Okay.
You found the place, huh?
You all set?
I'm all set.
Okay. Okay. All right. So no questions there?
Nope.
Okay. Sorry?
No, go ahead.
Okay. Moving on to COVID-19 updates, and that would be Agnieszka.
Yes. Oh, so no break yet. Cases are coming. Yes, in the last week, since last Tuesday, last week we got 34 new cases. Only today I got 7 new ones. and we are busy for sure.
What's the
Yeah,
total?
yeah. What's the status of the schools again at this point?
So the schools went back to their normal schedule, and we have several cases among students, but there was no exposure at school. Those kids were exposed in the households, so they are isolating. The contacts were notified, no contacts at school, because like I said, they were exposed during the holiday break. So we'll see, like one
I
day
see.
at a time, things can change overnight. So I know
Sure.
I'm working closely with the school nurses, with the principal, so we are all on the same page and have the same information. They share information with me because sometimes parents call the school before I get the results. Sometimes I am the first one who gets the results before even the parents. So that's why we have to work closely to make sure we all
I see.
share the information. So it's tense. It's a lot between all the 4 buildings, all the 4 nurses, and keeps me busy.
I'm sure it does. Well, we appreciate your service, that's for sure.
Thank you.
Anybody, any questions, anything to
Very
add?
good, thank you. So what is the total case number right now?
Right now, it's like 36 people in isolation.
Hmm.
That number changes every day because I get new cases. I'm releasing people every day. So it's like, changes a couple of times a day.
Yeah. All right, well, thank you very much.
Okay. Moving on, next on the agenda, we have EDS discussion.
Yes.
Kristen, EDS means again?
Emergency dispensing, right?
Sites.
Site.
Yes. So we have Felicia and her
Emergency
husband.
dispensing.
Site.
Site.
Emergency. Yes.
Yes, thank you for joining us this evening.
Yes. So we have experts here.
Felicia?
Hi. So,
Okay, yes, thank you for joining us this evening.
no problem. So
We
You're-
appreciate your,
you have both myself, I'm Felicia, and then you have my husband, David. And I'm going to give you a little background of the two of us. So I work for the state of Massachusetts, and I work for the Office of Preparedness and Emergency Management. And I am the regional coordinator for Region 3. You guys are Region 2, but I am Region 3. So I take care of north of Boston all the way down 495 to the Chelmsford area. And I work with the communities and their planners and the HMCC to make sure that their emergency dispensing site plans are effective and can be useful, and that the planners are kind of doing their job when it comes to it, and that we have a really good working plan. So that's my main role in my job currently. I've talked with Agnisa because I wanted to see if you guys needed any support with that, but I'll get to that in a second. I'm gonna let my husband introduce himself and what he does on his full-time job.
Hi, good evening, everybody. My name is Dave.
Hello.
I work for the Rhode Island Department of Health now.
good evening, Dave.
Good evening. For 12 years, and so in Massachusetts, they're called EDSs. In Rhode Island, they're called pods. Actually, most of the states call them pods, points of dispensing. And it's all about how do we get pills into people or vaccines into people. The operating plan is for 48 hours for something like anthrax or tularemia, but obviously this plan applies to this kind of thing as well. So for 5 years, I was observing all the plans for every municipality in the state of Rhode Island. And so I'm now the training and exercise director for the Center for Emergency Preparedness and Response. And right now I've been assigned to distributing PPE to nursing homes, assisted living facilities, and other outpatient providers in Rhode Island. So pretty busy at work.
Thank you.
So
Yes, thank you.
we know that each community does have a EDS plan, And in full disclosure, I have to be very, very clear of what my roles are, because I can get in trouble ethically if I cross over my job duties with the state and helping you out locally. But we wanted to, and we reached out because we have experience in this and saw that there might be a need with you guys and wanted to help if you needed it. And I think what we could possibly do is we took a look at your EDS plan that you have. And what we see is a shell, and we see a lot of kind of insert your town logo here. And here is a highlighted section where you're supposed to put the flow of, or the building of what your EDS is. And in full disclosure, we have a 4-year-old too who likes to come on camera, so you're gonna probably see him. But there's certain things. You have somebody in Region 2 that is paid to actually flesh this plan out pretty well. And from just looking over what we saw, it doesn't really look like they actually fleshed out very well. But there are areas in the plan that we think that decisions have to be made by the town. And once those decisions are made by the town, then you can go back to the planner and have them put them into the plan. And I also know that, my other side was working in emergency management. So I know that there's a crossover in communication between other departments to get the buy-in to make a plan really useful and beneficial. And I think that Dave and I could possibly, if you guys are looking for support, bridge that gap and maybe help drive some of that discussion on the municipal end, and maybe pull the right people into the room or the right people on a Zoom and have them kind of talk through how and make decisions about that plan, because right now your plan is just a shell. It doesn't have anything other than, it doesn't even have like a layout, an aerial photo of where your location is and how you're going to put people through. So, and we kind of charge the communities with taking that on, unless you wanted to partner with another community. And that's really entirely up to you guys. But we thought at first, we have kind of the experience with it. I wrote plans for the city of Providence, Rhode Island, and that's how Dave and I actually met. And he reviewed those plans. So, and then we got married, but
her plan was good.
Great marriage plan.
So we have, we know that I come from, city of Providence was pretty strict. In Massachusetts, we're a little bit more lax. It's really on the communities to come up with it. But if we have kind of some skill set that we can bring to the table while serving our community and kind of assisting, we want to make sure that we're offering that out. In full disclosure, I also work as a dispatcher for the town of Douglas. I do it part-time. I've been off for a little while, had a baby in the middle of COVID. So I haven't done it that often, but you see, like, we have the kids in here, but we would like to offer, if you wanted some assistance to try to maybe flesh out your plan a little bit more and get prepared for that public vaccination clinic. If you guys do so choose to do one,
we don't know what will be required of us in the future, but we should be prepared for anything what comes, because who knows what's going to be next.
Sure, absolutely.
And just for your information,
go ahead, I'm sorry.
Our current EDS site is a high school. And I think that location was picked a long time ago, before the elementary school was built. But even Felicia mentioned that maybe elementary school would be more convenient location, more practical, right?
Yeah, and we, in just the time that we've talked about it, which has probably been about a week and maybe a little bit more, even if you partnered with Webster, and we're not even sure, but I'm just throwing it out there. I'm not sure what the relationship is between the town. If you went to Maffrey, I know we all call it Mapfre, but we found out it's called Maffrey. If you go to Maffrey, that's a huge area that you could wrap a lot of, vehicles in and have it set up. And you want to look for sites like really large. But if we went just community specific, it might be ideal to go to that 3-school tier where you've got 2 ways in of egress and exit. You've got some fields. So I know people wouldn't like it to say like park on the fields, but you could park your staffing there, or, you know, you could talk about your flow in a little bit more. And also the storage of where you're going to either store the vaccine or store the medications. That would be, you know, another thing to think about too.
Yes, I like that. I think, you know, that's a good point. That's a good.
Yes,
option.
it is.
I don't want to get too in the weeds for this meeting, but a lot of it will depend on strategic decisions that the town wants to make. If this is going to be a drive-through situation, if this is going to be people are getting out of their cars, there's a lot of logistics and spatial considerations for parking. You know, and we're very big on different entrances and exits for cars because it creates less traffic bottlenecks. Especially inside the building, you want to have enough room for people to be able to space out, but also be inside and not, you know, exposed to the elements. You know, we might be, you know, April, so it could be iffy on the you know, weather spectrum, but you know, those are some of the things that we look for. We also need a lot of space, obviously, as everybody knows, the 6 foot and maybe even more spacing for vaccinations, and you need a lot of vaccinators. And this is a problem that not just Massachusetts or Rhode Island has. This is a nationwide problem. Pills are easy. We can train almost anybody to hand out pills. Vaccinations, that's a whole nother ball game. So this is a tough nut to crack. But if you know, you're going to have to make some strategic decisions about who's going to be doing the vaccinations, who's going to be running the I say pod, she says EDS, you know, all of those things, and what the staffing structure is going to look like, what the offering, you know, are we going to be doing it by appointment? Is it going to be drive-through? You know, so there's a lot of different questions that would need to be tackled before we say like, this is that plan. But you can have multiple options based on, you know, what the situation is. So, you know, that's something that if we, you know, we're going to be doing a follow-up at some other point in time, that we could get into that a little bit more.
That would be very helpful
Okay,
to us because we don't know where to start.
It sounds to me like, I mean, this is quite a project to assemble this kind of a plan, and also to designate certain people to, you know, to implement the plan. I don't know how you really go about that. You had mentioned how everything has to be approved by the town. Now, who exactly? The Board of Health or?
So sure, this is your plan.
Who?
So this is actually
Okay,
for
okay.
the Board of Health's plan. That's where the EDS resides
Okay.
in Massachusetts. Yeah. And so you actually have a plan. You have a planner that's come in. His name is Forrest, and you have Jamie. And the two of them are actually paid
Okay.
through the Public Health Emergency Preparedness Grant to assist you with it. So you have somebody that can do it. Just in the time that
I
I
see.
spoke with Agnista, what we've noticed is that there is like, you know, it's just like a shell. So I think where it needs to be built up is the decisions need to be made internally on that local level with yourselves, and then bringing in the, you know, the police chief, the fire chief, the town administrator, the board of selectmen, the school, the superintendent, your nurses. We
Sure.
jotted down on our notes. You have 4 nurses plus Agnista. Like, you know, that's not going to get you very far with a, you know, vaccination, but it's a start. And I don't think that
Sure.
you can, you know, like we're thinking like there's a lot of like collaboration that needs to happen, but I think you need to talk. There's very specific pieces about what you guys own as the health department, decisions that need, like, who signs for the medication. It's got to be somebody within the Board of Health. And, you know, who's your doctor that you're
Right.
going to have new standing orders, which is somebody you have as well. But that type of stuff, and then branching out from there.
I see. Sounds like we have to get the wheels turning.
But we are not alone. That's a good thing.
No, it's great to have the assistance. Just
And
that
I
we
feel
have to
like-
get things moving and work
Uh,
toward that. I'm
Who's
sorry?
talking? Are those people mentioned? Are they talking to like Matt Wojcik and Agnieszka and the selectmen or something? I don't even know who they are. I've never met them.
Well, evidently, I guess, according to Felicia and David, evidently, we have to, I guess I have to present that to Matt and see how he wants to go about, setting this. Well, actually, we have to go about setting it up. But I think I'm going to have to approach Matt first,
So you're the
the town
planner.
manager.
The planner, just to try to clarify, the planner is paid to do specific tasks that the Massachusetts Department of Health sets up each year and says you have to update 2 parts of the EDS plan. About 3 years ago, there was a major overhaul that happened with the plans, and they built a template, and they wanted to fill out the template. So they have the whole shell of the plan, but inside where it says, okay, who's
Right.
going to sign off on that medication? That's a town decision, and the planner can't put that in there. And so you'd
I
have
see.
to have, you'd
I
have to
see.
have that discussion. So we could ideally support
Okay.
you on that end and say, these are the things you really need to narrow down.
And they can-
And then we can give that to Nisa to give, and I'm sorry if I'm pronouncing your name wrong. Am I
No
catching it?
worries.
Okay. My last name is Porowski, my maiden last name. So I'm with you. I get it. But what we could do is provide that, call it out for you guys. You as a group could make those decisions, or search out who you need to make those decisions with, and talk through it. And then we can, we could summarize that for Nisa to go back to the planner to say, we need you to incorporate this into the plan. Like, and they do the work for
I
you,
see.
but we help drive your back end conversation where those decisions need to be made. And then they do that work that they're already getting paid for to do.
Yes. But at least we have to know what to ask for,
Okay.
like we have to understand before we go back to them, like what
Right.
our problems are.
Right.
Well, I think what she had mentioned is they have this shell. Okay, so it's like a boilerplate. It's like all we have to do is plug in different, right? Am I correct? We have to. The town has to decide who will be doing this or who will be doing that, and so on and so forth. That's what I gather. I don't know. I could be
Yes,
wrong.
and we got this shell in 2019, and I had a couple meetings with Matt and police chief and fire chief.
Uh-huh.
And we were going through the plan, but some of the questions they couldn't answer some of the questions. We didn't know who should we put, like really. So we did some
Sure.
information, like, was easy to talk about the traffic control. It's going to be a police department, but the rest, some of the questions, the titles were like a little confusing to us with no previous background.
But to your point, exactly that, the traffic control, right? We don't want to just say the police will handle it. What we would do is, I think what Dave and I could do is recommend, okay, how would the flow go? Would you want it this way? And then we get that and then give it to the planner and say, put it on the plan, put it in the plan. Here's what you
Okay.
want.
More specific. We
right.
need more specific plan. It's like general information right now.
Right. And standing orders. Standing orders are a thing. We're seeing that with the vaccine right now. You need a doctor to be able to sign off on the standing orders. They ask you who is the person that has the standing orders. I would default when, I had a conversation with Anissa about that, saying it would be the doctor that you have on, but in the EDS plan, it says, who is that person? And we don't have it listed. So how do you find somebody? I gave her some ideas about who to talk to, who maybe to pluck, but then it could be somebody that you bring onto the Board of Health, and that you might have a physician to come in to be able to assist specifically for that purpose.
Do you know any? We have an opening for a physician.
So,
I'm not one, sorry.
so we actually need a physician? Is that
Don't know
true?
what
Is that
I-
correct? We
You'll
actually need
somebody
a
for
physician.
standing orders. You don't have to necessarily have them on your Board of Health, but they could volunteer to support
Right.
your plan and provide those standing orders.
It's so
Yes, I
difficult
did.
to find physicians.
But you
And-
know what, Felicia,
In
when
fact,
you told me,
in fact, I think,
the fire department, they work with the physician who assigns that standing orders for EMTs.
Right.
That
And
would be
we can
ideal.
ask,
oh, yeah.
yeah, I
okay.
have his name, and we could, because I asked the fire chief, he gave me the name of the doctor from Milford.
Great.
I can ask if he would be willing to. This is just in case of emergency. This is when it's needed. It's not like he
Right.
has to do something for us now, like on
Right,
the weekly basis. No.
Right. So we suggested to leverage either, I know with emergency medical dispatch that they're needed back in the day, because I'm going to date myself. You had to have standing orders in those dispatch. What you read from the flip chart, because they used to have flip charts when you call 911 and you go through CPR, you have to read them word by word and line by line because they're signed off by a doctor. And that's why I have recommended maybe there is a doctor with that one. But if you got it with the fire chief, that's great. That's fantastic. That's a great start, right?
I have a name.
Felicia, I have a question.
Sure.
Does it have to be a medical doctor? Could it be an optometrist? Could it be a dentist? Does it have to be a medical doctor? Could it be a licensed practical nurse?
You know, I don't know the answer to that. I'm not going to lie. Do you know?
Well, it might be different in Mass. In Rhode Island, it has to be somebody who has prescribing authority. So it doesn't have to necessarily be an MD if an NP has
Yeah,
prescribing.
there are nurses. There are nurses that have that authority.
Yeah.
Yeah, no,
She's
nurse
gonna.
practitioner could be.
Yeah, I'm gonna ask that question. So
No, nurse practitioners, yeah, but
Now, in Rhode Island, the director of the health department for the whole state is the prescribing authority under these emergency orders. So unfortunately, it's different here in Mass.
they used to have a doctor that did all the standing orders in Mass, and then he retired, and then they made the decision to change and have it go where you had your own for each community. But I can certainly find that out. I know just the person to call and can follow back up on it.
Okay. Perfect.
okay. Are there any other questions?
So I guess our
Hi, Amanda.
our question
Happy New Year.
is if you guys want.
Hi, Happy New Year.
But just let us know.
Go ahead, I'm sorry.
Oh, no problem. So I was gonna say
Felicia, did you?
the only question I would have is if you guys want us to try to support you guys in that way, and if you see that there's a need for that, we in no way do we want to overstep our bounds, your toes, or get anybody upset. We just see that there's something that we could probably help the town with, and we want to do it to better the town. So
Nobody gets upset in Douglas.
So what's next?
Okay.
with that then?
Are
Is
there any other questions for Felicia?
I got one. What's next with that whole thing then, do we think?
Yeah.
The whole plan, emergency plan.
So I think that if Anissa is okay with it, I think David and I could go through and just look at things that need to get really decisions that need to be made. If you guys are okay with considering changing the location from the high school to the 3 schools, and we can just go off of that as a kind of like a base of what we kind of plan it out on. And then we can drive some of those questions home, because the questions are going to be the same regardless of the location. But at least if you have that location, we can start thinking about how things should probably flow, and maybe some recommendations for you guys to think about. And then I think with Agnesa, we can get her to plan a, they call it a site survey. And that's where the planner comes out, and there's a list, a survey that we can do. I have the list, we could do it, but I think in staying with my role and my job and not ethically crossing over, we need to wrap that planner in and have them come to that and walk the facility and see if it has those items in it, like the refrigeration system, and just see the layout of the school. So if there is floor plans and we can see them.
I can get them. Yeah.
Yeah, and then maybe make some recommendations off of that. The other thing is, and we don't want to scare you by this, because my husband and I go through what comes first, the chicken or the egg, right? Is we'd love to do that first, that portion, and then start talking about staffing, because staffing is always an issue. It's always the problem. It's always going to be the problem with volunteers, with do you have enough? But at least if you have like what you need, we can start weeding down where we could try to look for people or get volunteers from.
I
have a list of nurses from Douglas who live in Douglas who offered, to volunteer in the case of emergency. And of course, school nurses, I'm in a good relationship with all of them. They are always willing to help. So.
But to vaccinate 9,000 people,
yes,
we're talking more than 5 nurses.
Yes. And EMTs, they got the permission to administer vaccine in Massachusetts, right?
Yeah. Yes, I believe so.
Yes. So we have also, group of EMTs.
Right. We'll deal with what we got. You what's the timeline for this? Any idea?
So we work full time. I'm not going to lie. We work full time, and we can try to, we'll do as much as we can. I know that general population phase 3 is looking at the April time period.
I think it's probably going to be April.
Yeah.
That's probably about.
Oh, good. So we got like 3 more scheduled meetings before that.
And I think that, it's really getting our kind of draft thoughts on the table is easy. It's the decision making that it will drive how long the plan takes to get completed and get flushed out. And it's really the relationships that we can kind of leverage, in discussion. So we'll try our best, but we also have the 2 of them.
Yes.
We can do it.
Any help will be appreciated, even a
Absolutely.
tiny one. We understand.
I have a
Well,
question.
You are volunteering, and appreciate anything. And then, like advisor suggestions, that would be a lot for us.
So I have a question for David. David, as the training guy in Rhode Island, how long does it take to train somebody to do injections?
So I don't do clinical training. It's more disaster preparedness and training internally for our health department. But actually, so we have a statewide medical reserve corps, and they actually do vaccination training in one night for people who already have the license, that are able to do it. But we don't let just anybody go and vaccinate. That was one of the things when we do mass antibiotic dispensing. We can do a pod training for, completely lay personnel, in about 4 hours, and we could be running a pod, the next day theoretically. But when we're talking about vaccinations, it's a whole nother ball game, because we're not going to give people who are not, really have those skills and don't have those legal qualifications, say, here, go do shots.
Agnieszka, do you have an answer to that question?
Train someone to give a vaccine?
Yeah, a non-trained person.
I don't think there is an option right now for non-trained people to administer vaccine. You have to be a nurse or EMT, certified person. Person from the street cannot come and give vaccines to other people.
Thank you.
Okay. I think we've covered most of the bases. we also are, I'm sure we're able to contact Felicia at any time.
Mhm,
Um,
And the one thing that I would just ask of the group is so Dave and I are doing this of our own free will, of our
Sure.
own, like, I have to have this disclaimer with you guys. I would just ask that it doesn't get publicly advertised. I know that this is recorded. but-
No,
but
no,
publicly
when I,
advertised that a state worker is, because if
Right.
if it goes around to everybody, then people get really upset that somebody's helping, but this is my town,
Yeah.
and we live here and we want to make sure we're helping our town. And if
no,
it-
the only thing that you're doing for us, I mean, you're doing a lot for us actually, but when I say that, I mean, we're just asking for your suggestions. That's all. Maybe a little bit of guidance. That's all. And that's as far as it'd go.
Good.
I don't want to put you or your husband in any kind of a position that could cause your job for sure.
Yeah.
So no, we're going to be very discreet about that.
Okay,
Sure.
fantastic. That's the only thing I ask.
Okay. Thank you, Felicia.
Yeah.
Thank you, David.
Thank you.
Thank you, guys. Was nice to meet you.
Yes, you as well.
Okay, that's wonderful. Hi, Amanda. How are you? Happy New Year.
Hi, how are you? Sorry,
Good,
get in
good.
at the cold.
Okay, so that takes care of that. We have transfer station discussion, and there's always discussion about the transfer station. So, I may as well bring up this, go ahead. Did somebody say something? Oh. This proposed plan that we have about the transfer station, the bank going up, how we plan to deal with it right now. I mean, we don't know for sure exactly how we're going to deal with it, but this is just a recommendation. I think there's a PDF out there that you guys can click on, right?
Yeah, I sent it to their email, yeah.
It's in the email.
Yep.
Okay, so if you go to that PDF, you'll see what we propose is actually using riprap to cover those bankings. They're very steep. The incline is very, very steep. And I think we're all familiar with the situation up there anyhow, as far as that's concerned. So I don't really have to get into detail, but I was speaking with town engineer, and like he had mentioned, we probably do not want to get into anything too deep as far as construction, as far as building a retaining wall or whatever the case may be, because we really don't know what's underneath the ground there. We don't know if there's trash or garbage from years ago that could be under that driveway. How that was built and put together, we just assume not get involved in it, because it could be a real can of worms that we open up. So his suggestion was to do the riprap. At least it will be presentable. It'll be safe for the people who have to maintain that, our guys up there that maintain that property and do a good job. But we certainly don't want anybody slipping, falling, and getting hurt. Trying to mow that area with a lawnmower is just almost impossible. So the safest way, and probably the best looking aesthetically, would be to use this riprap as an option. And I guess what I'd like to know from you folks is how do you feel about it, and if you want to pursue this? So it's up to the board, whether or not we go ahead with this and we do a little more research. We get a cost analysis and get some prices.
It's pretty steep. He seemed to think that they could get that to stick right there.
Oh yeah, they excavate it, they'd excavate it and then they'd set the stone in there. They do it, you know, it's pretty common now.
Yeah.
But it would have to be excavated somewhat and,
Yeah. I mean, I wonder what size rocks they'd be bringing in to throw right there.
well, you know, probably boulders, not, I don't know, you know, but
Not huge, right? But
yeah,
it's-
yeah, but Corey, it looks a lot better than, you know, hay or straw.
Oh yeah. Oh, riprap. Yeah, it looks good. It's a good look.
Yeah,
This is
yeah.
really steep. Like you see it a lot on like rivers and
Yeah,
water.
yeah, yeah.
that type of thing, but-
It's neat looking. And like Bill was saying, you know, if we start getting into footings for retaining walls and everything else, we're going to be digging down pretty deep.
Yeah, for that.
We're going to have to
type-
come up, like he said, over 6 feet. You're talking, you know, now you're talking heavy construction.
Yeah, you'd have to rip back into the concrete, maybe even move the sheds to do some.
Yeah,
some
we
of the-
don't even know what's under the ground, like he said. We don't even know.
Yeah, all the plumbing and everything that could really get.
We have
messy.
no idea where it is. Yeah.
That could get messy. I mean, they're gonna have to be real careful even excavating for the rock, but that's a lot better because you don't have to dig that much. They're just kind of digging enough.
Yeah, yeah. I mean, I'm sure that they would, you know, have
They'll
to.
have it under.
They'd have to go gently.
Yeah, I mean,
Say the least.
I mean that could be a forever solution. You know, now
Yeah.
you just gotta weed it once in a while, walk around and pull or spray weeds instead of trying to mow that thing.
Yeah, just spray it. You know.
I mean, I'm in favor.
Yeah.
I think that's worth a discussion. I mean, do we want to get a quote? Do we need to?
Well, we're gonna do an analysis on it, and then we're gonna probably put it out to bid. If it's not too much, we'll probably just have somebody do it in town. You know, somebody from town do it,
No, it'd be great to have a local.
or it could even be the highway department for that matter.
Yeah, maybe
Yeah.
John's a good place to start.
Yeah, yeah. So we'll see how it works out here, but
What's the
I wanted
consensus
to.
of the board?
I wanted to know if the board wanted to pursue this or not, and if
Well,
so,
I
we'll.
did like the clover idea. I don't know how well it was working out. I don't think it didn't have a big chance to take off, but as a solution, as another solution, I do like riprap. So
Yeah.
I think riprap is the way to go also. The only question I would have is about the left 1/3. The land is not steep at all, and it would seem like we might want to quote it 2 different ways. The whole thing or without the left 1/3 roughly.
Yeah, you could do that. I mean, that's a possibility. Yeah.
different quotes. Yeah, maybe tell them like it'd be nice to have a little bit of grass right here.
Yeah, you have a little grass over there. It looks good. Yeah, yeah, that's a possibility.
I mean, it's gonna be not gonna be a big difference. I would imagine.
This is
Right.
just a very basic draft, so don't go by this.
That's
Okay?
right. This is a basic draft, right?
Yep.
So I think we should pursue more information and more look-sees at it.
Yep.
Is
Okay.
this enterprise? What would pay for this? Would this come out of the? Can we?
Well, we have to. That's why we have to present this as. I don't know. It may be a capital improvement. I don't know. I don't know how much it's gonna. You know, like Kristen just said, this is just a quick put together kind of plan that just to show you people and give us an idea of whether we're going to move forward or not.
Yeah, I guess
And,
the question is, if somebody comes back with a quote, are we going to be able to say yes, go ahead and do it? Do we have the funds?
Most likely, I would
Yeah,
say
depends
most
on-
likely.
Yeah, we have capital. It depends on how much it is.
Yeah.
All right, that was my question. If we could use that fund to
Yeah.
make, I think.
Good question.
improvements. I mean,
Yeah.
all right.
I would think.
But
the
we'll
next-
get. I'll have more detail coming up anyhow. So.
Yeah, I would think the next
we'll get
stop
it
is
out
the
there and
highway
you guys-
department.
Yep. Talk to John. All right.
Yeah, well, I'm kind of going according to Bill's guidance because he really knows the way here. So
Sure.
Yeah.
he's helping us out, and we'll see what he has to say about it. You know, his concern was, make sure that that everybody understands what direction we're going in, basically with the riprap. And not building a retaining wall and not
Right,
doing
rock
that
face
kind of thing.
that
So.
covering up the dirt.
So
with
I
rock.
think yeah. So If you'd like to move forward with this, we will do so.
Yeah, I think we should. I think that makes sense.
You want
Okay.
a motion?
Sure.
You want a motion?
Yes, sir. Yes, sir.
You want to be the head kingpin on it?
The head kingpin?
Yes.
I guess I am because I've been dealing with Bill anyhow, so.
Yeah, so I think that
Yeah,
we should
I've been
authorize,
dealing with Bill and also. Okay. That's fine.
yeah, I think you should be the person that goes off to the next step, and you come back and you say, here's what we think we really want to do.
Sure.
And then we go
Sure.
out and take a look at votes on it.
Exactly. Yeah, that's fine. I'll take the forefront on this one, but I don't mind. It's just, and it's probably the best way because I have been dealing with Bill. So
Yeah, I think so too.
yeah, we'll go that direction. So if we get a what was I going to say?
A motion?
Yeah, we need
So
a motion. Yeah, that's what we need.
What
Dick,
form
do
motion-
you have a motion?
Well, there are several forms. One form is that we authorize you to just go off and do the research and come back to us. And that would be one.
That's
motion.
all we're
Another-
talking about right now is, right.
Okay. And let's make that as the
We're
motion.
just talking research right now. We're just talking
All right.
research.
Yes, I'll second
Yeah.
that.
Third.
Okay, all in favor?
I,
Aye.
Aye.
Okay, motion is passed. Okay, Dick, about the transfer station, you had mentioned that you were gonna work with the guys up there to come up with
Yes.
some sort of a design or a different design or a layout, or have you gotten anywhere with that at all?
not on the layout, no. What I've been working with them on is the apparent problem of compactor B. And I say apparent problem because they have started taking numbers of pressure. And then when you try to correlate that with tonnage, I mean, there's not a direct relationship. You could, if you were trying to compact lead, for instance, you couldn't do it very well, so you'd build up pressure quickly and it would be very heavy. But if you tried to compact something that moved a lot, then you might have a lot less weight. So what we're looking at is A, B compared to each other, figuring that when people throw away their trash, they are not making a selection between A and B, they're just picking the one that's open or the one they've been asked to do. So what I did is I ran mean, median, and standard deviation for the year, the 11 months of 2020. And I also looked at 2019 as a composite year, the whole year. And I find only two places that B was significantly different than A. And those months were October of this past year and May of this past year. Other than that, A and B track pretty much the same. So what we're looking at is, do we have a flaky, that's a nice technical term, pressure monitor in B that once in a while it goes crazy. And EMP has said they would come look at it. They didn't do it last week. They said they would twice. They didn't do either time. And I didn't get to him today, so I don't have
Actually,
the
they were
answer
there
whether they
today.
did it today or not.
Yeah, he was there
Okay.
today.
Do we know what they found out?
No,
What they found
as
out?
I was pulling up, he was leaving. I tried to flag him down. He just took off.
All right. I will get to them tomorrow and find out what they found.
Yeah.
But Dick and George are keep, and Ron and Ray are keep of the pressures of the units A and B. The other thing that's interesting is the number of trips is varying all over the countryside, and I don't have a handle on that yet. But for instance, it varies from like 37 to 59 on the number of
Yeah.
trips a month. And that needs some looking at too, why that variation is like that. And I don't have the answer to that yet either. But
Well,
thinking
I
good.
think that a lot of it has to do with COVID. You know, a lot of people are home. A lot of people are, in other words, it's hard to track exactly how the transfer station is taking this stuff in. I mean, I've spent a lot of time up there on just about every day that they're open. And I see what's going on in the operation. And it seems like there's much more trash being disposed of. Large bulk items being disposed of, and it's costly to run that operation up there. So, you know, that's why we have to come up with probably a better plan somehow. We had talked about adding 2 compactors
Yes,
and eliminating some of the containers, the large containers. So rather than just throwing, say, for example, cardboard into a container, we compress it, we compact it, and it reduces the amount of trips that we have to make. It just makes a lot of sense to do it that way. But we have to look into that also. That's something else that we have to look into. And are you looking into that, Dick? Are you gonna
Yep.
take
I
that
will.
control? And
yeah, the thing that I was trying to get,
also,
right, what I was trying to get was this perception that we had a compression problem in B, and put that to bed. And
yeah,
when I look with the guy tomorrow, we may have an answer. For instance, on A in September, the tonnages on A in September were 12, 5, 5, 12, 5, 11, 4.
yeah,
I mean, those are all over the place. And
yeah,
I
they
would,
are.
and that's on A. And I would think that we
Right.
would be looking to maximize the tonnage per trip. And I think
November
they-
looked a lot better.
But you got to keep in mind too, that we're looking at a piece of paper. Those guys up there are trying to figure out how they're going to make it through the weekend and making sure that maybe sometimes
Absolutely.
they have to unload, a container before it has to be unloaded. But they have to plan it too. And it's very difficult to do that because
Yeah.
from one weekend to the next, we just don't know how it's going to work out.
I know, and I'm not trying to be critical. I'm just trying to understand.
No, I know you're not. No.
And get them to,
Yeah. I'm
and
just
then-
saying that those figures, you can't completely go by just the figure,
yes.
because there's
Understand.
more to it.
Right.
And then there were a couple of times
Yeah.
in the past year that we emptied the A container on Monday, and Wednesday it was full again. And there was only one day between them. And I'm saying, how's that possible to fill a container in one day? So anyway, there are some things that I'm still working on.
A lot of trash.
Yeah. I have seen that 1 day container fill up. I've seen that happen.
Yeah,
Also, Bob, like you-
It varies so much. Go ahead.
saying putting it what you said, the trips, because working where I work, we do have a dumpster company, and due to the current times, they sell out all the time due
Yeah.
to people cleaning out their houses. So
Yeah.
I understand what you're saying about so many trips and
Absolutely.
everything filling up quick. Like
right.
the house that will
Yeah.
go dump, there are multiple. They filling it in the tonnages. It holds up to 2 tons and sometimes like tons per one trip. So to say what you're saying, I
Right,
agree
right.
with everybody being home. They're cleaning out everything and doing all kinds of projects. So that could be
Yeah.
one of the reasons, like you said.
Could be a big increase this year, yeah.
Oh, yes. We also have residents from Uxbridge that are dumping in Douglas. So we found out this week. So we found out this week.
What are
How
they on?
nice, huh? No, but
Yeah,
in all seriousness, that's something else we have to do is watch, watch these people coming in and out. I mean, some of them try and slip through there, and the guys are on top of it. They're doing a pretty good
They
job
are.
up there, I'll tell you.
So they
they
Yeah.
caught the
do
guy
a good
anyways?
job.
They're on top of it.
Well, that's good. They caught the guy, huh?
So,
So Bob,
yeah, yeah.
what I will do is
so-
this week,
yes, sir.
I will also start work on the third and fourth compactors and see where we can take that. But I will start this week.
Okay, good. That'd be great, because we have to get a bid together. We have to start looking at that. That's very
Right.
important.
Right.
Okay, thank you for your input, Amanda. That's great.
Of course.
And you're right. You're right on there.
Yeah,
Okay.
it's been very busy.
Anything else? Anything else on the transfer station? No questions? Nothing? Okay, let's move on out. We have Tire Day again, so what are the results of Tire Day?
No, we need just to cross it off. That was old from last agenda.
Oh, cross it off? Okay. Okay, how about bills and warrants? Are there any questions on bills and warrants? That should be in there. Is that on a PDF?
Yeah, I sent it. I sent it today.
Yeah, we got it. I got it.
Yeah, I got it. No questions. Me.
Okay. No questions. Great. Okay, so all set there. Tonnages, we did touch on the tonnages here. There's a sheet that, there's another PDF that was provided by Kristen.
Yeah, I thought they looked a lot better this round.
And again, they're not bad. Couple of them, maybe a little low, but all in all, I think they're doing a heck of a job up
Yeah,
there.
no, I thought the average was a lot better that month.
Yes, November
Absolutely.
November's really good.
Yeah.
Yes, yes, it is. Yes, it is.
So whatever.
Okay, so no questions on that?
Whatever that hiccup was, they must have figured it
Okay,
out.
so, what's that, Corey?
So whatever that hiccup was, September, October.
What's
they
that?
must have figured it out.
Oh, yeah, right. Well, they really are doing a good job up there. They're trying to control the flow as much as they can. They're trying to make sure that all the containers are being used properly. They're not throwing things that they shouldn't be throwing in, that kind of, although you're always going to get people that are going to do that anyway, so.
Yeah, nothing.
But anyway, okay, so how about, do we have an approval of the minutes of the last meeting?
I would make a motion that we approve the minutes from last meeting. I didn't see anything wrong with it.
Second,
Okay, all in favor?
aye.
Okay, all in favor?
Hi.
Okay, so that's approved. And how about old or new business? Anything new, anything old? I guess not. Okay, well, do we have a motion to adjourn?
We need a meeting.
Do we have the next meeting?
Oh, the next
We only
meeting,
got a couple
yes.
left to figure out that emergency plan, so we gotta be on top of the meeting.
How about February 1?
Yeah, I know it.
February 1, okay?
Feb 1.
Yep.
Yeah, that sounds good.
We may have to have a meeting for a variance, just a quick meeting at some point in the next couple weeks.
What?
That's fine. That's fine.
No
So
problem.
February 1st.
Even if we get quorum,
Yeah,
No problem.
okay,
What was the date? I'm sorry.
February 1st.
February
February
1st.
Okay.
Zoom meeting.
I guess.
Some of us will try to figure out how to get into the meeting sooner.
That's horrible. Yeah.
Was I not the only
Yeah,
one?
that was not a good.
No, I couldn't do it either.
Oh, okay.
All right, move we adjourn.
Second,
Okay, motion to adjourn.
second.
All in favor? Seconded?
Hi.
Aye, aye,
Aye.
aye, aye.
Okay, meeting is adjourned. January 4th, 2021 at what time?
7:19.
7:19.